What percentage of kids are responding, and what's the sort of response range?
The response rate is probably closer to 65 to 70%. And the big question is, why don't 30% respond? And I'll answer that later, because I think now that I've given up surgery, I'm starting to find some other things that are important to do. But it ranges from having the kid just more present, that they're not in a fantasy world anymore. But I've had kids go from special needs schools to regular schools. I've had kids that didn't talk, start talking, kids that weren't potty trained, become potty trained.
And do you have to keep the infusion, repeating the infusions? How long is the course of treatment?
There's never been a study of more than one treatment. The paper was released in 2019, followed by the pandemic. And like we talked about with Dr. Potter, and you talked about with Dr. Potter, all sorts of research got shut down. And so the Duke study showed that what they did was they gave the stem cells, then they tested the kids every month. And they noticed that they started to see growth, better improvements on the autism rating scale starting at 2 months. It peaked between 6 and 7 months, but they followed these kids for a year. After that, a total of 18 months, and there was no decrease. So we know that the improvement kind of peaks at 6 to 7 months. And the question is, what do you do then? Do you give another dose? And certainly I do. Probably 40% of my patients come back for a second dose, and we see further gains.